In this updated video, I will be reviewing the epidemiology of COVID-19 as of January 15th, 2021. All data to date continues to support infection spread by respiratory secretions. Close contacts inhale droplets or aerosol associated with coughing or sneezing, as well as when talking and even when breathing. Droplets can also land on surfaces where they can survive for hours to days. Infected surface particles are often called fomites, and for SARS-CoV-2 fomites have proved to be a rare route of spread, and absolute proof of fomite spread has not been published. Droplets usually do not project beyond 2 meters or 6 feet when someone speaks or coughs. However, a powerful sneeze can project droplets longer distances. The size of the droplets varies, and when talking, coughing, or sneezing, we may produce a population of small particles under 5 microns in size called aerosols, and these fine particles can stay in the air for up to 3 hours. These small particles will only contain a few virions, and therefore significant numbers of particles need to be inhaled. However, the discovery of a new, more infectious mutant from the United Kingdom, labeled VUI 2020-12-1, has enhanced the efficiency of spread by 50 to 80%. These mutants bind H2 receptors with higher affinity, and therefore fewer virions are required to cause disease. Singing and certain procedures, such as intubation, are known to generate larger amounts of aerosol. This mode of spread is thought to explain outbreaks in bars, restaurants, churches, and indoor malls. Recent studies now find that asymptomatic or pre-symptomatic infections make up a very significant percentage of cases. On the Diamond Princess cruise ship, over 600 individuals positive tests for the virus, and 18% were asymptomatic. More recent studies now estimate that 40 to 60% of those who are infected are either pre-symptomatic or asymptomatic. Children and adolescents are more likely to have minimal symptoms. There are also several reports of superspreaders. One of the most notorious examples is Case 31 from South Korea. This 35-year-old Chinese woman traveled from Wuhan, China to Daegu, South Korea, where she visited a megachurch twice, as well as visited a hospital, and while febrile, ate at a buffet before she was diagnosed. Tracing determined that she had come into contact with over 1,160 people. It is likely these superspreaders generate more aerosol. The virus can also be found in stool, but is difficult to culture, and no cases of transmission by this route have been reported. To date, perinatal transmission is rare, but has been reported. Tracing studies reveal that an infected host can infect 2.0 to 2.7 others. This number is termed the R0 or reproductive number, and this virus is one of the most highly infectious agents ever reported. The more infectious UK mutant may have an R0 of 4.0 to nearly 5. The efficiency spread also varies depending on the degree of crowding. For example, in New York City, the R0 was 5.0 prior to mandating shelter in place. In-depth analysis now reveals that individuals who are infected vary with regards to their ability to spread infection. The 80-20 rule applies. That is, 20% of those infected account for 80% of the infections. Therefore, each superspreader, on average, would be expected to infect 10 to 30 individuals. Why 10 to 20% of infected individuals become superspreaders while 80% fail to spread the infection is not known. However, superspreaders are thought to have higher concentrations of virus in their secretions, up to 1 billion and even 1 trillion viral particles per ml. Strategies to control the spread of infection should focus on identifying these superspreaders and quickly isolating them. But more on this issue in our revised prevention videos. The recent surge in cases throughout North America and Europe emphasizes the role of weather. Dry, cool weather enhances aerosol spread and forces people to stay inside. The majority of cases are acquired by household contact. Original estimates were that 10% of household contact develop disease. However, the CDC prospective study in Tennessee has revealed recently that 59% of household contacts become infected, and 75% of these infections develop within 5 days of identifying the first infected family member. It's no wonder that 80 to 85% of infections are contracted within the family, called family clusters. Other settings have included the megachurch in South Korea with 1,200 cases, cruise ships, sporting events, bars, restaurants, and gyms, other large gatherings. One of the most publicized recent superspreader events occurred at the White House during the announcement of the nominee for the Supreme Court Justice. As shown in these pictures, people sat close together without masks and also socialized in a closed space, again without masks. This behavior resulted in a point source outbreak of 32 infections beginning 4 days after September 26th event. The bar graph shows the number of participants who became infected over time. The first case was identified 4 days after the event, the number of infected participants peaking with 10 cases 6 days after the event on October 2nd, and the last 2 cases being identified 18 days after exposure. As countries have opened bars, coffee shops, and restaurants, and gyms, outbreaks of disease have been observed. As this figure on the CDC MMWR Morbidity and Mortality Weekly Report of September 11th revealed, those who ate in restaurants had 2.8 times higher risk of contracting the virus and a 3.9 times higher risk if they went to a bar or coffee shop. When it comes to these locations, masks need to be removed during eating and drinking and usually are closed, poorly ventilated spaces with increased risk of containing infectious aerosol clouds. Visiting a gym or a church was associated with a modest but not statistically significant increased risk of 1.6-fold, as shown in this figure. Points to the right of the line indicate increased risk, points to the left of the line decreased risk. The brackets indicate the error bars or range of potential variation. As you can see, for the churches and gyms, the error bars are very wide, extending below 1, making conclusions about these spaces less definitive. In the early phase of the epidemic in both China and Italy, a large portion of nosocomial transmissions, that is, transmissions within the hospital, occurred through contacts between clinicians and visitors with no or mild symptoms of COVID-19. A number of healthcare professionals also contracted the virus in New York City. In addition to doctors and nurses, support staff who were not provided with adequate PPE became ill. Healthcare professionals must be aware and remember Dr. Cece. I will be discussing how caregivers can protect themselves in Module 2. When it comes to who is infected, this virus is an equal opportunity promoter. Everyone appears to be equally susceptible, with a possible exception of children under 10. Males and females are infected with nearly the same frequency. However, males and older adults tend to develop more severe disease. More about this in the video on clinical manifestations. Our understanding of how the virus infects humans, described in the first video on pathogenesis, is supported by studies of viral counts in the nasopharynx and throat over time. Soon after being infected, 1 to 2 days before the onset of symptoms, as well as during the first 3 to 4 days of symptoms, the counts are very high, 10 to the 9th to 10 to the 12th, and these patients are most infectious at that period. Some individuals shed the virus for many weeks. However, live virus has not been cultured beyond 10 days after the onset of symptoms. To summarize the content of this video, transmission is predominantly by droplets and aerosol. Contaminated surfaces are likely to play a minor role. Beware of the asymptomatic superspreader. Rapid spread from person to person occurs predominantly in families and less commonly spread in large gatherings, cruise ships, closed public spaces, including restaurants, coffee houses, and bars with an R sub 0 of 2 to 2.7, and for the new mutant virus, R sub 0 of up to 5. 10 to 20% of those infected are primarily responsible for spreading the infection to others, on average, each infecting 10 to 30 individuals. This is why larger gatherings should be avoided. If there is a super spreader in the room, as occurred in the U.S. White House, a large outbreak is likely. With the exception of children less than 10, all individuals are infected equally. Individuals are infectious for 2 days before and 3 to 4 days after the onset of symptoms, and their secretions can contain very high concentrations of virus, billions to a trillion viral particles per ml.